as we call them, after the end of the junior doctors' strike. What's going on? Tom Dolphin, consultant and member of the BMA Consultants Committee, is with us now. Hello to you, Mr. Dolphin. Tell us why you're striking.
Good morning. We are striking because we've reached a situation where our pay has been cut by 35% over the last 15 years. We're starting to see that affecting recruitment into the NHS. There are 8,000 empty doctor posts across, consultant posts across the NHS. It's affecting patient care. It's stopping us from being able to get through the backlog. We've reached that point now where we've got no choice but to strike because the government refuses to negotiate, refuses to even recognise that there's a problem, and the government will need to sort this out if they want us to get through that backlog of people waiting for treatment.
OK, so when you say 35% cut, are you basing that on RPI or CPI?
It's based on a range of things. It's based on inflationary measures, it's based on changes to pension contributions, lots of different things that contribute to mean that the value of our salary has dropped by that much, by more than a third over that time period. What we're seeing, in effect, is that the people are working for basically 4 months of the year for free, in effect, compared to 2008.
Yeah, we're just putting a graphic on screen as we're talking to you, doctors, because I just want to drill down on these numbers. We've been doing some research here at Sky. According to the Nuffield Trust, the BMA using an outdated measure of inflation, the retail price index, and what most people are using now, including the ONS, is a CPI. So you are still seeing a decrease in pay, but it's 15% since 2010 and not 35%. So what would you say in response to that?
Well, it suits the government to use RPI when they're calculating things like student loan repayments, and we think that RPI is a better measure of the actual living costs that our members face, because it includes things like housing costs and so on that CPI doesn't. And the key thing is that when you're looking at recruitment of the NHS, when you're seeing salaries in other countries that have not been eroded by this way, when you can go to Australia or New Zealand or just across the border to Ireland and almost double your salary or more, we are not going to be able to compete with that in the UK. The government has to address that, and it's not really about the amount or the calculations that we're doing, it's about the NHS and the care that we need to be able to provide, and we can't do that with understaffed departments.
Average total earnings for consultants after this pay rise, we're told, will be £134,000 a year. Plus, consultants can retire at 65 with a tax-free pension of up to £60,000 a year. That tax-free pension is exactly what you wanted to see as part of the previous budget. And it was your number one ask of the BMA, which the government has done, is what they would say.
It's not a tax-free pension, it's a pension that we are no longer being punitively taxed for no reason for minor changes in the pension income. That's what was sorted out in the budget most recently. That doesn't do anything about the value of the pension that's also been eroded, because the value of the pension depends on the value of pay. And the amounts that you're quoting for the salaries, that includes a vast amount of overtime. We're all doing lots of overtime because there are so many gaps in the service. We're trying to cover those gaps for our absent, non-existent consultants because we need to get through the backlog. That's what we're focusing on. That's why we need the government to come back to the table, because we are really struggling across the NHS to fill these posts. Pay is a big part of that, and if the government doesn't sort it out, we're going to struggle.
And none of this includes, of course, private health work, which you're also entitled to do.
Well, fewer than a third of consultants do private work. I don't do any private work. But for those that do, if they choose to spend their own time, and that's what we're talking about, their own time, doing additional work to make up for the income they've lost because the NHS pay is being cut year after year, that's their business, really. And, you know, good luck to them. OK. I noticed that you've been tweeting a warning about media coverage over the last 24 hours or so. And advising consultants or work with consultants, it's important to pass on this warning. The next 48 hours of media coverage will be relentlessly negative about doctors. They'll harp on about private work, pensions, inflation, and all kinds of nonsense. Forewarned is forewarned. You go on to say the negativity is designed to sap the will of striking workers. They'll make it seem like the whole country is lined up against you and that you've made a bad decision to strike. Don't believe them. Neither is true. You can see it for what it is, government anti-strike rhetoric. So not quite sure why you think that we would be guided by the government. I'm not picking out any particular outlet to say that any particular news outlet is guided by the government, but we've certainly seen a relentless, as I've said in my tweet, relentless tide of negativity about doctors and about the NHS over the last few months while doctors have been striking, and certainly today because consultants are striking. I think it's perfectly fair to say that unions are under attack in the UK, and they're simply standing up for their members and standing up for the terms and conditions in the NHS. I think that's a very reasonable thing to do.
Why do you think the media would want to pile on senior doctors, though? All we're doing is quoting facts to you and asking you to respond to them.
Well, we're doing selective fact-checking, as I said, because when you're talking about the amounts of income, for example, you're including, as I said, all of the additional work that people are doing in order to make up for the lost NHS income, in order to cover also for the gaps in the service. And then it makes it look like we are actually making unreasonable demand. I'm not really here to talk about sort of media policy with you. I'm here to talk about... Sorry, carry on.
When you say, I mean, what is the base salary for a consultant?
The base salary for a consultant starts at just over £90,000, with last week's 6% pay settlements. Yeah, £97,000.
I mean, that is a lot of money for people who are struggling, isn't it? And, you know, it's one of the people going on strike, which perfectly entitled to do. That's one of the highest figures that we've seen people going out on strike on so far over the last couple of years of disputes with the government. I mean, how much sympathy do you expect?
To some extent, it doesn't matter what you or I or Steve Barclay thinks about how much consultants are paid. You can't separate workforce and pay. If you want the service to be staffed properly, then you have to be able to attract and recruit and retain staff. And as I said, we are competing with other countries with much nicer weather than ours who are offering double the NHS's salaries or even more, and people are responding to that. We used to rely on doctors coming from overseas to the UK to help staff our service, and we are now competing. We're seeing them going to Australia as well. Not only our own doctors, but people used to come here from India, from Malaysia, Pakistan. They're now going to Australia and Canada and New Zealand as well, because they're offering much better salaries than we are in the NHS.
Not much the government can do about the weather, though, is it? Not much the government can do about the weather. I'm not quite sure what that's got to do with it.
I'm just saying that life can be much better in some of these other countries in terms of not just the pay, but also the terms and conditions, the working conditions that people are working in. That's my point. And if you want the NHS to be properly staffed, you've got to value the staff in it. And people talk about how much nurses are paid. Nurses should also be being paid more. We are struggling to recruit nurses as well. This is about the whole service and about valuing it. The government talks about valuing the NHS, but they're not following that up with the money that's needed.
Can we expect more strikes?
The government doesn't seem to be showing much willingness to come back to the table to negotiate, so it's up to them. If they want to stop the strikes, they need to come back to us with a credible offer we can put to our members so that we can stop the strikes. We don't want to be striking, much rather be doing some work and seeing patients, because that's what we went to medical school to do. But the government doesn't seem to want to negotiate. That's up to them. Our door is always open.
So is that yes?
I'm sorry, I didn't hear that.
I said, so is that a yes?
Is what a yes?
Are there going to be more strikes?
That's up to the government. If the government wants to come back with a better offer that we can put to our members, then hopefully we can avoid more strikes. That's up to the government.
And if they don't?
Then there will be more strikes, yes.
Thank you for joining us on the programme. Fire crews from several European countries have been sent to